episode of Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi, joined by Mandi, Dickey, who is back today for another exciting episode for you guys. We're fired up as always. We are on AM 950 radio, and a lot of times we don't really necessarily pre-script these things. It's just about what we're observing in healthcare and how we can help you guys become really the CEOs of your healthcare. We hope you tune in every week and learn something. I know last week we really talked about the insurance mess that's going on. Obviously, the recent horrible tragedy that's happened, and really how it's really put to the forefront the issue of how the current insurance model in this country doesn't really work necessarily for the patients. It certainly does not work for the providers, who are getting more and more upset. But today, we're going to more focus on how you can get the most out of your visit when you come and see us, because it's so important. One of the things we talked about with the insurance situation is the fact that it does lead, because of cuts in reimbursement, cuts to systems, all kinds of stuff, it's led to visits being a lot shorter. So people really have to get the best out of their visits. And in my clinic, every once in a while, I see visits that are very memorable to me. And this particular visit that kind of spurred our discussion today was a very high-level attorney in town who came to see me as a second opinion. And I was really struck and had an amazing conversation with him, which of course put me way behind in my clinic that day, but really had a conversation about all of these questions. He came as prepared as any patient I think I've ever seen in spine, and actually was challenging me, unbeknownst to know that these are things I talk about all the time. I've talked about it way back in radio, and I talk about it on LinkedIn, all this stuff. And I'll talk about that visit on the other side of the break. And right now, I'm just going to ask, how important is it for people to really come mentally prepared with materials and just ready to have that interaction? Because again, it's their entire, that's their whole day. For the provider, it's just that 15 minutes or 20 minutes or 30 minutes if they're really lucky, right? How important is it?
It's incredibly important. As most patients know, as they're trying to get their appointments, it takes a long time to get into your provider. And if you go unprepared, you're not going to have your questions answered. You're going to leave feeling like, what just happened because I didn't get done what I wanted to get done. So having that preparation before you come will make that appointment go so much smoother, and you'll feel more valued from it.
And as a provider who sees a lot of patients, wouldn't you agree that when people come prepared, you feel like you're having that real discussion, because they're looking to look for you to help them with already that they're already prepared. They're like, I want to take control of my health. How frustrating it though is on the flip side when they have no idea what's right, despite the fact they've been dealing with this for maybe sometimes years. And they still don't have a clue.
Yeah. It's hard as a provider, because then you don't know exactly where to go. You need them to be part of that team, so that you guys both are on the same page and you both know where it's going, what your options are, what your treatment plan is going to be. The patient has to be part of that team. And if they're not verbalizing what they need, you can't provide to them as a provider the best care that you need to.
Yeah, absolutely. And the other, and we'll talk about it on the other side as we dig into this topic a little bit. I really hope this helps you guys that are listening. One of the things I want to talk about with Mandi is the fear factor. And the problem is, if you're not prepared and you're really nervous and you've got a surgery upcoming, or you have to switch medications, or something else is going on, you're going to literally be at a loss for words, and you're going to leave there not knowing what is going on potentially. And so you got to be prepared. So on the other side of the break, we'll pick this up. We're on AM 950 radio. This is Recharging the Human Battery. Your host, Dr. Stefano Sinicropi, with Mandi, Dickey. We'll see you on the other side of the break. And we are back on Recharging Hypercharging the Human Battery Radio. I'm your host, Dr. Stefano Sinicropi, joined by Mandi, Dickey, my co-host, and many times, as you know, host of the program when I'm not here. And we are on AM 950 radio, and we're excited today because, instead of like we did last week, talking about kind of the negativity of the whole insurance debacle and how you can kind of get around that, we're really talking about, and hopefully you guys are listening, how you can best prepare to come and see us if you really need our advice, our guidance, whatever you need from us, because again, you're hiring us to be the kind of the managers of that department of your health. Remember, you're in charge. And I want you guys to get that through your heads. You are in charge. You're the CEO of your health. You cannot turn that over to other people. Obviously, if you have something devastating or whatever, you need to let the specialist do what they need to do and give you the best care. But generally, for chronic diseases and other things, you've got to be in the mix. You can, and one of the things we just talked about again in the break is people. So many of you, not you, I don't want to pick on anybody, but so many people that come and see us, they're not even in the. It's not like I'm asking you things about some random person or, oh hey, do you know what's going on with this celebrity or something? I'm asking you about you. Why are you not really in tune? How do these medications work? What are the potential side effects? What are my options? Where do I go? Just coming in and just kind of just putting it all on us, and then we preach to you what you should be doing. I don't think that that's the most efficient way. A lot of times I have to do that, and I just say, here's my recommendations, A, B, and C, and it's more of me just kind of preaching. But that's not what I want to do. I want to have a conversation. So instead of talking about, for example, I was in clinic yesterday and I had a lot of patients on my schedule. Many of them were very uninformed, and it's not through no fault of their own. People don't sit around all day listening to radio shows like ours or obsessed on LinkedIn about what's the latest and the greatest and in wellness and healthcare. And they're used to kind of being taken care of by the system, by the safety net. But you need to be your own safety net is the point. So this visit that I had, it was really great. So there was this really high profile attorney that came to see me as a second opinion, nicest guy in the world, has a really serious problem. And it's interesting because he has something going on with his spinal cord, which it's very compressed. He's had surgery recommended for him. And he was a little bit taken aback in his first visit because he doesn't feel like maybe necessarily it was explained that well and this and that. So he's here for a second opinion. And that's very typical. People don't understand or they don't quite vibe with the doctor or other provider, and then they seek care elsewhere. In this case, this is just one where he already had this pre-planned. He was going to have a second, visit. But the thing that's interesting is we went through his MRIs, we went through his history, we did a physical examination, we did all that. So I'm just expecting. I made a recommendation. I said, yeah, I do agree with the other doctor that you need some type of surgery. My recommendation was slightly different. I made a couple jokes about how if you see 10 spine surgeons, you get 15 different opinions because sometimes they change their mind and unbeknownst to even themselves because they just look at it and they get a fresh view. And super nice guy. And then he went into his questions, and that's where it got really interesting in a very positive way. So he was asking very critical questions. He's like, if I were to have spine surgery, why should I choose you? Period. And we got into that whole thing. I'm going to ask you your thoughts on that in a second, and then I'm going to tell you kind of where I tell people and what I've been saying. It was an interesting situation because it is one where this gentleman had compression on his spinal cord and early symptoms of things not working well, very early symptoms, but the amount of compression was bad. So it's one of those pictures that if I were to see that picture and didn't see him, I would say this person is coming in a wheelchair. That's how bad the compression was. Without getting into the thing, but there was a lot of damage on his spinal cord. It was very swollen. It was very it was a very impressive picture. And then you have this guy who's jolly and asking all these questions and has a couple little very subtle findings. And so he's asking, well, if I've had this all along, I've had this whole time, why? He really wanted to get in. What are the pros? What are the cons? But of making a decision, am I making a poor decision by not having surgery? How does it happen? And I'll just kind of we'll talk about that a little bit. I mean, he was going into really like very detailed questions about, well, what if this happens? What if this complication were to happen? Then what do I do? Like, what are my resources for that? How, like things he knew all about, like the different options for different hospitals versus surgery centers and all these different questions. And the interesting thing, like while we were having this question, and something that I brought up before, is the fear thing. Now, this guy has a serious problem on the scans, maybe not manifesting as serious, but obviously so the other surgeon who was alarmed is like, oh my God, you need surgery right away. And yet he's as calm, he's as cool as a cucumber. Why? Because he's as prepared as can be and understands and has really done a lot of research. This guy's watching videos, he's doing all kinds of stuff. So, it's a really good visit. So let's dissect some of these things and how we can help you. I love that it's something I've talked about so often. Why should I choose you? And I'll share some of my thoughts afterwards. What's your and I know you're a brain health provider, Mandi. You've done it a long time. You've worked with physicians, high profile people yourself. When you get asked that, either about why should they entrust you with their care, or anything, or why should they entrust you or whoever, or they're just seeing you one time, but they live in South Carolina. Like, why should I go to this guy? Like, why? Or why should I trust the physician you're working with or whoever, or why should I trust this radiology people to do my stuff? Kind of where do you go with that? I know off the top of your head. Again, we don't prepare for this stuff. I just ask Mandi because these are things that we just get asked. So guess what? I don't like if people just ask me questions in a visit. I just have to answer. I can't like go and prepare for it. I'm prepared because I've been doing this for a long time. But you have to be able to answer these things. What say you?
My first thing is I never want to badmouth anybody else, because if you badmouth other people, that puts you in a negative light to the patient as well. So I will never badmouth anybody else and say that, oh, you shouldn't go see this person for X, Y, and Z. It will be highlighting what I can do and what my team can do. And that's maybe my experience, what I've done. And I've taught a lot of physicians as a nurse practitioner, even. I have taught a lot of physicians how to take care of stroke patients. So I highlight my background, my experience, so that they know where I've been, what I've done, and why I'm qualified to take care of them without bad-mouthing somebody else. Because, again, you never know what's going to come out of that. But
right. I've
heard a lot of people that have negative connotations toward providers that will just badmouth other providers, because that's not a good, respectful way to go either.
But it also doesn't make. I mean, on that front, you bring up another, a good point. It is that happens sometimes, and some of you will hear it. You'll hear negativity about this person or that institute or the other institute, or they do this or they do that. The truth is, a lot of times we know the general work that people are doing, but we are much better speaking for ourselves and our expertise and what we can do, because when you speak in a negative connotation or you're trying to sell a patient, on yourself, like, it's not about selling, it's about telling them what your qualifications are and whatever. So some of the things that I talk about as far as especially when there's a complaint, they're not happy with the visit they had. The first thing I say is that we all have different personalities, and the first thing I bring up to them is, like, when you go to that barbecue for 4th of July with your family, is every conversation you have with every person the same? Right? When you talk to Anita as opposed to, talking to Sam, both your cousins, it's wildly different. One might be a happy person. One is like, they're a little bit low on the happiness quotient. One is disgruntled. One is super bouncy. You're going to get different things, and providers are whatever. So I try to take the personality thing out of it. I think it's very important for people to vibe with their providers, because again, like we don't have time to get into the metaphysical stuff. But as you guys know that follow me, you know, I'm big into Dr. Joe Dispenza and all these other stuff and meditation and getting into these states and the quantum world and the fact that we can tap into this invisible world. I don't want you guys to say, when I do spine surgery, we're not tapping into the quantum field. We're just doing spine surgery, so I don't want to scare you guys. But I'm just saying I'm very much into these things because I believe that through our energy levels, our spirit, and other things, we can, it's a big part of healing. So I think it's really important that people do vibe with their providers because it is important in the healing process. Now, if you were to pick with somebody you vibe with that's not good and somebody that you don't vibe with at all, but it is a world-class expert, go with the world-class expert. Don't get me wrong. If you can get both, you won the lottery. Congratulations. Go with that person. Great. Stick with them. Don't let them go. Don't let them retire, right? But if it's the flip side, you know, just be careful. I'm not telling you that just because you guys are, you know, like, you know, having a great time with a doctor. If obviously they have all bad reviews and they have all kinds of other stuff going on. That's not. I don't want to counsel you on that. And remember, none of this is medical advice. So just be careful. So going back to the other thing is we might see some of the things that other providers do. And maybe we don't agree with it, but to be honest with you, we've got to be really careful because we have these biases because we're human. And so there's not many people that don't think that they're the best, right?
Yeah.
I mean, how many people do you know that, I mean, there are people that go around, but generally, you know, most providers think that they're the best at what they do. Would you agree with that part of it?
Yes.
So... think that was a good subtle, you know, one word answer. She's like, let's not go there too far. But again, I don't necessarily you know, want to focus on the other provider. We want to focus on ourselves. So just to tell you, like for me, when people see me, I'm just very I'm very honest. I just say, well, I mean, I've been doing this for a long time. You know, by next year I'll have done 10,000 spine surgeries. I've seen tens of thousands of patients. I've done X amount of this surgery. It's all about safety. Clearly the studies show that the more you do whatever it is you do, right? The more you read, right, EKGs, the better you are at it. Now AI, we have all kinds of, you know, fancy, you know, tools to do this, but the more you do something, generally the better you are at it. So there is an experience factor that people should know. You should be very open and honest about complications you've had, especially in that particular thing. And that was the other thing he brought up. He wanted to know specifically, you know, complications. So we went through like doing anterior surgery versus posterior, you know, rates of complications. Now the good news is the complication rates for what he's very extremely low, you know, in our hands, you know, the way we've done stuff, and we can provide all that to the patient. We have to be really open and honest. And one of the things that I'm very open, and I think that we have to be very open. I tell people, you know, and I told the guy, I said, listen, yeah, I've done pushing 10,000 surgeries, but this is what can happen, and it's real. And so there are providers that are, you know, that do that. Nothing's going to happen. Like you can't do that because that is not part of them being prepared, you know, for what's coming down the road. I mean, I know that is your style, right? You're very much in a position where you tell people this is what can happen. Yep. Right?
Yeah. And I will say too, I was consulted several times for stroke in the hospital or neurological issues, and the patient was there for surgery for something else, and they would ask me about their own surgery because they didn't feel like they were knowledgeable about it. And if it was something that I had exposure to or knew about, then we would have a conversation and say, well, just so you know, this, and this can happen. And they weren't aware of that. I'm like, well, it is a possible risk, so you need to know that, but I still think that you're choosing the right decision because of X, Y, and Z or whatever. But it was, you need to be knowledgeable and things appropriately. So they need to know that information, need to be upfront. Yeah.
Yeah. Well, and some of that informed consent is you informing your you know, yourself. One of my pet peeves is after having like really extensive discussions with my patients, especially when it's complex. I mean, if I'm just taking out a disc herniation and it's whatever, I just say, this is what I did. Here's the complication risk. Here's whatever. But if it's a bigger surgery, we really have to go in depth. But it's also them. They have to. So one of my pet peeves is we give them all of this material. I talk to them ad nauseum. And then they still don't know why, because they don't want to. Now, part of that is the fear.
Yeah.
And so the more they're prepared, the less you're going to have fear. But you have to take. I mean, if we want to have an aside, and again, this is a very kind of this is the kind of discussions that we have amongst ourselves when we want to make things better for our patients. But when you get those materials, you need to dissect those materials, and you need to ask questions when you have the opportunity to ask questions. And then if you feel like your questions are not answered, then you need to ask more questions, and you have to ask more questions. And if you are in a situation where people don't want to answer your questions, it's not the right place, because it is it is your life. Remember, you are hiring us to be the managers of that division, right? So if you hire me on the spine side, I am kind of the manager of your spine division, right? And so I have to manage it appropriately, and you're the boss, you're the CEO, so you get to, you say, well, what's this? What are you going to do with this? What's going to, when are you selling this? What's this widget? What's that? You got to ask the questions at the time, not like after after you've had your surgery, like when you're in the hospital bed, and then you're asking, what kind of surgery did I have? Are you kidding me? How many times you've signed consents? We've given you all this paperwork. So I this is a lecture that I have my patients. So I would say back to the why choose me? Why choose you? This is the thing, and I've learned this over a long period of time. Two more points. One is, I think if you really want to figure out if you want to choose that person, yes, you can use things like the internet and Google and health grades and all these other things where we're quasi-evaluated by people. We have to be careful there, because I personally know some really excellent physicians who've had a few disgruntled patients that then just go on and on about something. And sometimes it's not even about the surgeon. It's about their office, or, oh my God, this fax didn't go through, and now my disability paperwork got screwed up, and they write a dissertation about that doctor, and then it balloons into something. So you got to be careful about that. But yes, go on there and get a general feel for what they do. But one of the things I tell people, and one of the things I told this lawyer, and I do it all the time, I said, you really want to know if a doctor's good? One, ask some of the most non-biased people, and I'll tell you who they are. They're the nursing staff at the hospitals that we do our surgeries. So I just told them, I said, here, I operate at these two places, okay? Literally call there. Call the front desk at the operating room. This is all public. These are all public numbers. Just call there and ask the nurses, hey, I'm going to this doctor. Would you go to that doctor? Would you let them do this procedure? That's a little different in the procedural world, but you can do similar things for people that practice in other ways. I mean, you could even call their offices and talk to somebody and ask them, hey, would you go? And honestly, those people, because they don't really have they don't have skin in the game. They just want to help people. I mean, nurses are the most amazing. Like, they really want to help, but they do it on the flip side too. So if you're going to somebody and that person maybe is not amazing, they're going to tell you. Whereas if you ask your own doctor who referred you, potentially, they might not want to say that, because that's who they refer to and that's their buddy or whatever. And again, I'm not saying this is life. This is just the way things go. I mean, we're just honest on this program. I'm not going to sugarcoat like that. I mean, things happen. People have friendships and they have stuff. So that's why you have to be the CEO. You can't let people just kind of manage your life. You got to manage your own life. But if you reach out to nurses or techs, or if you're having everywhere, you can call surgery centers where people do procedures. Ask the techs there, hey, would you have this stuff? Like, what's going on? Like, what are the complication rates? All this stuff. And you have an open book. And the more we're open book as providers, the better it is for the patients to get to the right place and to get the right vibe. You can get so much information by going to these non-traditional places. I've been talking about this I think I was on a radio show in Texas. I wasn't in Texas, I was here, but I was being interviewed on and I talked about that, and I just said, hey, you want the real deal? You want non-biased? Start calling people and see, and people, listen, let's be honest. People know who to go and where to go. Like, the insiders know. Talk to the insiders. Okay, don't talk to your there's a lot of different people that you can go to. And the other thing is, you can certainly ask your doctor if you're having a very complex procedure. I've done this a lot for my patients. There are people that are so nice, some of my patients, they're willing to have conversations with other people. So if we're going to do a giant adult scoliosis surgery, there are people that I have in my toolbox that I can just say, hey, this person has agreed to, I'm not going to have them being called once a week, but yes, you're having a complex thing, you're very afraid, call this person, they'll tell you how it was. How was it? And we have these classes that you can go to at the hospitals and this and that. Okay, last thing I'm going to say, and this is really important because we've hit this point many times as far as where to go, and I think this is important. There are doctors that are very subspecialized and they're fantastic at what they do. One of the things, though, that doctors or providers or whatever, but one of the things that we have to be careful with is we want to make sure that we're very open about what we are specialized in. And I'm gonna make that more clear. So I'm a spine surgeon. And let's just say that let's say that I was an endoscopic spine surgeon. I did or not, but all I do is endoscopy. I'm amazingly special. I might be the best at that, right? However, it is very important for me that's very specialized in that thing then to explain to people, well, there's this, but then there's these other 6 ways to do that. I do this, and here's why I believe it's best. But you have these other options, and maybe these are the upsides and the downsides of it. And please do your own research before you decide you want to do this. And so, for me, particularly as a spine surgeon, I've always made it. And again, this isn't. It's not a right or wrong thing, but I like, for example, when I like my neck surgeries or back surgeries, I do it a lot of different ways. I've just made it a thing to learn a lot of different techniques because I really do think that specific techniques are better for certain things, and the more you get experience, the more you understand that. And so I want to put as many tools in my toolbox, just like when we talk about general health and wellness. The problem is that sometimes people are in a silo, and if you're a hammer, everything's a nail. That doesn't mean that person is not incredible at doing that, but you need to know your options so you can make the best thing. And I'm not saying they might be able to, perform magic doing it one way. Some people can. Some people are that good. That's just the way it is. But that's very, very important. So this question is very critical. Doctor, that's great. I love what you're saying, or to the nurse practitioner or whoever. But what are my other options? And what are other people doing in this town? Or are there things that you just don't do? Or I'm really curious about this procedure. What do you think? And again, we have to be careful about when people shoot down procedures that they've never done or gone to a course on or done, a deep dive. So I think it's good to understand that people have different tools in the toolbox. Like, for example, yesterday, this guy, he had cord compression. I say, there are multiple ways to skin this. And I've really done most of them as far as the ways to decompress it. But I think, based on my understanding, that you would be best served by this because you have less risk of having to come back for surgery, blah, blah. I mean, I just went into a big, like, very detailed thing because he wanted to know. But yet I said, yes, the other doctor that recommended that's absolutely above board. That's also gold standard for this procedure. That's this. I also do that procedure. I was absolutely trained to do that, and I still do them in certain circumstances. But I don't want to do that on you unless you absolutely decide you want to do that, because I think that you have a higher risk of having these other things happen. But there's many times that I just let people know, you know what, this is best handled by this approach. I don't do that approach. Somebody in my practice does it. Or none of us do that approach. I'm going to send you to Mayo. I'm going to send you to Cincinnati. I'm going to send you to Harvard. I'm going to send you where you're going to get the best care, because you hired me to be your manager, and I have to just be forthright. I'm not going to be like, knowing what I know, which is why we should always be expanding our horizons and the way we think about these things. And nowhere have I expanded more. Like, my career has been in this, but in obviously in the wellness and health, like, my toolbox is infinitely bigger than it was just a couple years ago. Would you agree that that's like so critical to understand that there's different options? Yeah. And they need to know the person that is kind of, not to pigeonhole them into an option. And if it is the best option, to explain why it's better than X, Y, and Z, and whether they do it or not, and whether they should see a second opinion with the person that does that the most and see what they think. and come to a consensus.
Yeah, yeah. Having worked in neurology as long as I did, it was not a procedural based practice. So I had the joy of not having a specific bias because there were so many options, and I could just have a conversation with the patient about these are the things that we can do to treat this or to diagnose it. And if you choose whichever one, I can tell you somebody that I think would be great for that because they're the best that I've known at that particular procedure. The only procedure that we really did was lumbar puncture. So when we were doing lumbar punctures, we were looking for specific things in the spine, in the spinal fluid, and in which case there really isn't another option, unfortunately. So sometimes there are no other options for things, and then I would have the conversation about what happens if we don't do that. So that's your option. You have the option to do it. You have the option to not do it. So even when there aren't a bunch of options, you still have choices as a patient that you can choose to do something or to not do something. And that is your right as the patient to make that decision to not do anything too. That's sometimes the most reasonable choice.
Absolutely.
So that's always an option, and you have to have the conversation about all those different options and the pros and cons of them so that, again, they can make that informed decision.
Yeah, and absolutely. And I love what you just said right now. As a patient, and I mean, right, like I said, I am now about 75% done with my book. And that brings up a topic. We just keep going right back to the thing. Take it in your own hands. Take it in your own hands. And rights. You have rights. There's actually a patient, Bill of Rights. You should read it. It's very interesting.
You're supposed to sign off on it every time.
Yeah, absolutely. But we give it. I mean, you get it. You come to the clinic, you get like the patient Bill of Rights. You go to a hospital, you get this Bill of Rights.
Yeah.
It's your right to know. It's your right to transparency. It's your right to ask questions. And I will tell you this. And it's something that I talk about and we got to be careful because one thing that you cannot just say, okay, this is fine. If you have questions and people are refusing to answer it, that is not appropriate on our end. It's literally what we signed up for as providers. We are there to facilitate it, but I have to answer your questions. It is your right to have your questions answered, and it's just going to be better that way. Because I will tell you, if you don't ask questions and you just give up your rights, okay, it's no different than, in a legal situation. If you just give up your rights, yeah, whatever. Well, yeah, just throw me in prison. Sounds great. Yeah, I don't really care about my rights. Just lock me away. I know I didn't do anything, but I'm not gonna, exercise my rights here. It's not a good idea. And when you gotta take advantage of the time that you have with these providers because they do have a tremendous amount of knowledge, to impart. But you cannot accept no as an answer. And honestly, I talk about this in a chapter where we talk about some of the things that bother me about providers and my observation, because a lot of the book is about my observations about providers, how care is delivered in this country. Obviously, I chime in on insurance companies and all your favorite topics. You'll see. But we really talk about one of my pet peeves is not treating that patient as kind of a I don't want to say conspirator, that never sounds good, but kind of as we're working together. It's a partnership. It's not us lecturing to you, and that paternalistic system doesn't work. And I'll tell you, if with certain people, like even if you clearly don't have an understanding and you have no questions and you clearly don't understand, people are trying to get to the next visit. And so if they have a busy day, and I mean, a lot people are maybe or not going to take the time to just like, really? You don't want to know more? Like, I'm just going to shove it down. No, I'll just move on. You don't care? You want to have this, you want to be on these meds and you don't really care? Here, just take them because I think it's best for you and you will like it. You will take this and you will like it, and that's not good. All right. And I'm just being. Am I wrong on that? Like people will just walk out, and I'm like, and you could tell, and it's a pet peeve. So and I'll just stop them and I say, you understand, like if we're talking about a major surgery, I'm just like, you're clear that there's like major. Yes, you have a major problem, but there's major risks. You understand that whatever, and some patient, I don't want to know anything else. I can't live this way. I really don't care what you have to say, but you need to know. You need to know.
Yeah.
because you just have to have an understanding, because otherwise you'll be upset when we've talked about these things and maybe they happen and then you don't know. So again, the whole thing about you will take
Yeah.
this and you will like it. Do you agree? Like
Yeah.
that happens so much, and it's so bothersome. It is so bothersome to see people like, you take a drug.
Yeah.
I just give you a
Yeah.
drug. That drug can have all the, here, just take this. Sure,
Yeah.
I'll just take it. Yeah, maybe I'll, one of the side effects is, you bleed from both eyes for, a couple months. Yeah, but it only happens a few times, but, whatever. So what do you say to that kind of stuff? How bothersome is that to you? The acceptance of stuff.
Yeah. I don't let patients get out without at least asking one question. I think early on in my practice, the best word of advice I ever got was somebody said, don't ask the patients, do you have any questions? Ask, what questions do you have? Because then it is just an expectation that there will be questions. So then patients will ask me, well, what questions should I be asking? And I'm like, well, other people in your situation would ask me this, this, and this. And then I will go through some of those questions. And then I say, what else can I describe for you? Because again, it gives that expectation that there are more questions that you should be asking. So then they start to kind of fumble a little bit. Well, okay, maybe I do have a question. So there are always questions. There should always be questions. You should never leave an appointment and not have asked one question, because there should be always something that you need clarification on.
Yeah, and absolutely. And if you're going to have spine surgery, there should be more than one question. There should be a lot of questions. If not, now, the more we become experienced in this, having seen so many patients over my career, I kind of have a specific spiel, and I try to cover in when I have discussed it, all the FAQs, right? Frequently asked questions, but then I want them to ask questions specific to their life. Hey, I'm a truck driver, specifically, when can I do this? When can I do this? You need to know that, because otherwise you're in limbo afterwards. You have no idea. You had the surgeon, you could have asked the specific questions, and now you're just trying to ask random people. It's hard to get back into the surgeon's clinic. It's, it's a whole other thing. And it's interesting that you bring that up, and I love that I love the way you frame it. But yes, after I talked about that great visit that I had, with this particular patient yesterday, after all this, I was in there for a long time. It was a great visit. I loved it, because he was just challenging me. And next thing you know, I'm talking about, like, I have talks coming up and I'm talking about this. And he was really interested. He was very dialed into everything. At the end of all that, I'm thinking, wow, this is a great thing. And he looks at me right in the eye and he's like, what questions did I not ask? Let's go through those. And so then we went, I had a few other, nuanced things about the hospital stay and, kind of his rooming situation and all these different things that we didn't ask. That's the stuff that is, so far down the line. We almost never get to, really the minutia of it, because obviously we have other staff and stuff that can answer that. But I actually, at the end of the visit, I actually thanked him for his visit. It was great. It was awesome. And I said, thanks. I said, this is a good, this is giving me another kind of push in the back to keep promoting these ideas of the patients really being informed when they come to their visits and do it. And I'm like, okay, I'm going to do this on this is perfect for the radio show and to do some social media stuff, because it's really important. And again, some of you are listening and you're like, duh. Like, you guys are, this is like Captain Obvious, talking to Captain Obvious on the show today. But the truth is, I will tell you, 75% of people that I see are not prepared for their visits, despite the fact we have stuff on our website that says how to prepare, all this other stuff. They're just not prepared. They're just there. They're just sitting there. Yeah, what's next? Without any, I was like, well, you got to prepare. So that makes it a little bit, a little harder. So thanks. I thought those were, great things. We're coming to the break now. I think we can just close it up. Maybe if you, I'll challenge Mandi here, maybe with telling us about a specific patient and maybe how something changed by a question that was brought up or something. Because I can tell you, there's a lot of times I'll bring things up. I'm like, you didn't ask about this. And then I tell them that, and they completely change. They're like, whoa. Oh, no, maybe. No, I'm going to get another opinion because you just told me I should get another opinion. And they never thought of it. But I want them to really comprehensively feel like I've educated them enough that they're really making an informed decision, like you say. All right, we'll see you guys on the other side of the break. We're on AM 950 radio. This is Recharging the Human Battery. I'm Dr. Stefano Sinicropi. Mandi Dickey is getting her thoughts together for the other side of the break, and we will see you in a minute.
Welcome back from the break. Here we are on AM 950 radio with Recharging the Human Battery. Myself, Mandi Dickey, and Dr. Sinicropi today. We've been talking about your rights as a patient, your opportunity to get the most information out of your visits when you come see us as providers and when you go see anybody as a provider. And I do have one last really kind of big thought that I don't know if I can do this in one short little segment, but really big thought on when you go to get the most out of your appointment. I don't have a specific example on this so much as just to say that take notes. And in neurology, for as long as I've been in practice, I've always recommended that my patients bring somebody with them as a second set of ears. Somebody to help you remember, somebody to help ask more questions, because sometimes that person that comes with you, whether it's your parent, your spouse, your caregiver, they might have questions that you didn't think about. And again, dealing with so many patients that have memory issues and other cognitive issues in neurology clinics, it's really important because you might not remember to tell the provider all your symptoms. You might not remember all the questions that you want to ask. In my own recovery, I've had to learn to bring a notebook with me. So I have my little electronic notebook, but it's with me all the time. And I have a folder on there specifically for my medical questions. So before I go to an appointment, I'll write down the questions that I have that I want to make sure that I have that conversation with my provider. And then I take notes on that same page so that I know what we talked about. And yes, I got my questions answered so that I know that I'm leaving with all the information that I needed to get out of that information, out of that appointment. And again, having somebody with me. When I was at my worst and couldn't remember things, I had my husband come with me because he was my second set of questions. He was my person to help me remember. Because I could walk out of that appointment and not remember what happened. And when you're dealing with people that have cognitive issues, regardless of the specialty that they go see, you're going to have that issue where they're not going to remember. I can't tell you how many times I've had patients come back and say, well, I don't remember us talking about that. But it was in my note. So I know that we did talk about it. Or if they had their family member with her, oh, no, we did talk about that, remember? But it's really important to have that other person so that you can get the most out of your appointment. Because we can say all these things that we want today and have it be well and good that you go and ask all these questions. But if you don't remember to ask the questions or you don't remember the answers, it's going to make a big difference. And when you're having something like a surgery, it's important that you understand what's going on and you remember the risk factors that you were told so that when you come to the hospital and you have to go through them again, do you remember all the conversations that we had so that it doesn't take your provider another hour to answer questions right before your procedure when you should have known about that beforehand, which you probably did, but you probably don't remember it. Emotions are high when you come to appointments. It's really hard to remember what's going on. Yeah, that fear piece that we talked about earlier that we didn't get into as deeply.
Depression, anxiety, people are whatever, and the other people are not as afraid.
Yeah.
Sometimes they are. If it's a parent of a kid, obviously they're going to be fear. But usually the caregiver or whoever, they have a fear, but no matter what, it's not you that's so that you can maybe come with a little bit of a more, I don't want to say rational, it's not that people are irrational, but they're nervous. When you're nervous, your brain is not functioning on all cylinders. So
yeah the other part of that is if you can't get somebody to come with you, I've had several patients ask me, can I record our visit? And I personally am fine with that because there's nothing that I'm going to say that I'm going to regret having you recorded.
I allow people all the time to record.
Great. I was going to ask that same question.
All the time. No problem.
It's good to have that information so that you can go back and remember what you talked about. And if there are further questions, reach out to your care team provider because you need to have all of the information so that you know what's going on.
Yeah, absolutely. I mean, on the recording thing, I think that's great, especially if they don't have somebody else with them. I also, one of the things we brought up is get somebody on the phone. If they can't come, just call whoever, call your Aunt Sally and get her on the phone, and then you have another pair of ears. But we do that all the time. We get spouses and family members on the phone. Unfortunately, our time has thinned out. We could do a whole episode about fear and how that plays in potentially to making not the best decisions for your own health, or rushing into things. It may be, a seed for an upcoming episode. Anyway, it's been amazing being with you guys. Recharging the Human Battery, Dr. Stefano Sinicropi, Mandi, Dickey. Take care of your families. We've got the holidays coming up. We could go on forever about how to take care of your mental health over the holidays. Be safe, be well, be CEOs of your own healthcare. We're on AM 950 radio, and we'll see you next time.